The other study that was reported looking in the maintenance setting was a study of Pembrolizumab. So this was reported by Matt Galsky and largely showed a similar trend. So there's a consistent trend towards a benefit in the maintenance setting of immunotherapy. So it's always nice when you see multiple things pointing in the same direction. There are a number of ongoing studies that are perhaps starting to look at some of the novel agents that we have in this disease and maybe looking at moving them into the maintenance setting. Many of these new agents are moving earlier and earlier. And so I think that the maintenance concept is interesting in that you get the initial benefit from the chemotherapy, and then you do something to maintain that response. And I think for patients, psychologically, not just waiting for the shoe to drop, if you will, is important. And I think that the maintenance setting is a very interesting and potentially very important setting, even as we explore new treatments in the future.